Vertigo is a sensation that leaves you feeling like the world is spinning around you, and it can be a frightening experience. It's not uncommon to experience dizziness or lightheadedness at some point in life, but when it becomes persistent, it could be a sign of something more serious. Understanding the symptoms, causes, and treatment options for vertigo can help you manage this condition and improve your quality of life. If you have vertigo, it's important to make adjustments to your daily routine to minimize symptoms and reduce the risk of falls or injury. Here are some things you should consider stopping or modifying if you have vertigo. Number 1. Avoid sudden head movements. Rapid or abrupt head motions can trigger vertigo episodes, especially if you have a condition like benign paroxysmal positional vertigo, BPPV. BPPV is a common cause of vertigo, which occurs when small calcium carbonate crystals in the inner ear become dislodged and move into the semicircular canals, disrupting the balance system. To minimize the risk of vertigo episodes, it's essential to practice moving your head slowly and gently when changing positions. For example, when getting out of bed in the morning, sit up slowly and give yourself a moment to adjust before standing up. Similarly, when turning your head to look at something or someone, make the motion smooth and gradual. In some cases, you may benefit from vestibular rehabilitation, a form of physical therapy that aims to improve your balance and reduce dizziness. Vestibular rehabilitation may involve specific head and body movements designed to help your brain adapt to changes in the inner ear and reduce vertigo symptoms. A healthcare professional or vestibular therapist can guide you through these exercises and provide personalized recommendations based on your condition. By avoiding sudden head movements and practicing intentional, slow head motion, you can reduce the frequency and severity of vertigo episodes, ultimately improving your quality of life. 2. Reduce exposure to visual triggers. Certain visual stimuli can provoke or worsen vertigo symptoms, particularly if you have a vestibular disorder like Meniere's disease or vestibular migraine. Busy patterns, flickering lights, and fast-paced or visually intense movies or video games can overstimulate the brain and cause dizziness or disorientation. To minimize the impact of visual triggers on your vertigo, consider limiting screen time. Spending long hours in front of screens, such as computers, tablets, or smartphones, can exacerbate vertigo symptoms. Take regular breaks. Follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds, and adjust screen brightness and contrast to reduce eye strain. You can also opt for less visually stimulating content. Choose movies, TV shows, or video games with slower pacing and fewer intense visual effects. Avoid 3D movies, virtual reality experiences, or content with rapid camera movements, as these can trigger vertigo symptoms. Another would be to modify your environment. Remove or rearrange visually busy patterns in your home or workspace, such as wallpaper, carpeting, or curtains with complex designs. Opt for more calming and visually simple decor. In addition, ensure rooms are well lit and avoid flickering or overly bright lights. You may also benefit from wearing sunglasses outdoors or using polarized lenses to reduce glare. Make sure to minimize exposure to crowds and busy environments. Large gatherings or crowded spaces, such as shopping malls or concerts, can be visually overwhelming and trigger vertigo symptoms. Plan your outings during less busy times or choose less crowded settings when possible. By reducing exposure to visual triggers, you can decrease the likelihood of vertigo episodes and improve your overall well-being. Remember to consult with a healthcare professional for personalized advice and support in managing your vertigo symptoms. Number 3. Limit alcohol and caffeine consumption. Both alcohol and caffeine can exacerbate vertigo symptoms by affecting the inner ear and central nervous system. Reducing or eliminating these substances from your diet can help improve your vertigo symptoms and overall health. Alcohol can cause dizziness and imbalance by altering the fluid composition in the inner ear, which is essential for maintaining balance. Excessive alcohol consumption can also lead to dehydration, which may contribute to dizziness and vertigo. Furthermore, alcohol can interact with medications used to treat vertigo or other health conditions, potentially increasing side effects or reducing their effectiveness. To minimize the impact of alcohol on vertigo, consider reducing your intake or abstaining completely. Another trigger could be caffeine. Caffeine is a stimulant found in coffee, tea, chocolate, and many energy drinks and soft drinks. It can cause increased heart rate, blood pressure fluctuations, and nervous system stimulation, which may exacerbate vertigo symptoms in some individuals. Additionally, excessive caffeine consumption can lead to dehydration, further worsening dizziness and imbalance. To reduce the potential effects of caffeine on vertigo, consider cutting back on caffeinated beverages and foods or switching to decaffeinated alternatives. Keep in mind that individual sensitivity to alcohol and caffeine may vary. Some people may experience vertigo symptoms with only minimal exposure, while others may tolerate moderate amounts without issue. It's essential to pay attention to your body's responses and adjust your consumption accordingly. As always, consult with a healthcare professional for personalized guidance on managing vertigo symptoms and making appropriate dietary modifications. Number 4. Be cautious with medications. Some medications can contribute to vertigo or dizziness as a side effect. These may include sedatives, antidepressants, blood pressure medications, diuretics, anti-seizure drugs, and certain pain relievers. If you suspect that a medication may be worsening your vertigo symptoms, it's important to discuss your concerns with your healthcare provider. They can help determine if a medication is the cause and suggest possible alternatives or adjustments if necessary. One helpful tip would be to review your medications. Make a list of all prescription and over-the-counter medications, vitamins, and supplements you are currently taking. Share this list with your healthcare provider to help them identify potential interactions or side effects that may be contributing to your vertigo symptoms. Another would be to not stop medications abruptly. Stopping a medication suddenly, especially if it's a prescription medication, can lead to withdrawal symptoms or exacerbate your vertigo. Always consult your healthcare provider before making any changes to your medication regimen, and follow their instructions for safely tapering off or adjusting medications. Also make sure to monitor side effects. Pay close attention to how you feel after taking medications, and keep a record of any side effects or symptoms you experience. This information can help your healthcare provider determine if a particular medication is causing or worsening your vertigo symptoms. You can also ask about alternative treatment options. If a medication is identified as a potential cause of your vertigo, your healthcare provider may be able to suggest an alternative treatment option with fewer side effects. This could involve switching to a different medication, adjusting the dosage, or exploring non-pharmacological treatments such as physical therapy or relaxation techniques. By working closely with your healthcare provider and being cautious with medications, you can help minimize the impact of medication-related vertigo and improve your overall well-being. Number 5. Avoid bending over or looking upwards. Certain body positions, such as bending over or looking upwards for extended periods, can trigger or worsen vertigo symptoms. This is particularly true for individuals with benign paroxysmal positional vertigo, BPPV, a common cause of vertigo that occurs when calcium carbonate crystals in the inner ear become dislodged and move into the semicircular canals. It's also important to be mindful of head and neck positioning. When reaching for objects or performing tasks, try to maintain a neutral head and neck position. Avoid tilting your head back or bending at the waist to pick up items. Instead, bend your knees and lower yourself closer to the ground, keeping your head upright. You can also adjust your environment. Make modifications to your living or working space to minimize the need for bending over or looking upwards. For example, place frequently used items at eye level and use tools like grabbers or step stools to avoid bending and reaching. Make sure to take breaks and change positions. If a task requires you to maintain an awkward position for an extended period, take frequent breaks and change positions to reduce the strain on your neck and head. Another tip would be to practice good posture. Maintaining proper posture can help minimize the risk of vertigo episodes triggered by body positioning. Keep your head aligned with your spine and avoid slouching or craning your neck. You can also consult a healthcare professional. If you frequently experience vertigo episodes triggered by certain body positions, consult a healthcare professional for personalized advice and potential treatment options. They may recommend vestibular rehabilitation exercises or other therapies to help manage your symptoms. By being mindful of your body positioning and making adjustments to your daily routine, you can reduce the likelihood of vertigo episodes related to bending over or looking upwards. If you've enjoyed this video and helped you learn more about gout, please be sure to subscribe to our channel and click the notification bell so that each week we release a brand new, life-saving video, you'll get notified right away.